Cerebral vascular malformations occur in 0.1 to 4.0% of the general population. One of them are cavernous malformations. Cavernous malformations are abnormally formed blood vessels having the appearance of a small mulberry. While they can appear anywhere in the body, they usually create problems in the brain or the spinal cord. The size of cavernoma usually varies from 2 mm to several centimeters in diameter. Histology shows that they are composed of dilated thin-walled capillaries within thin endothelial lining. Elastic fibers or smooth muscles are not present in the vessel walls. Because of this, blood flow through these cavities or caverns is slow, and without structural support, blood leakage occurs in the surrounding tissue. The surrounding tissue of cavernomas turns hemosiderin-laden because of the blood leakage, and the surrounding is usually gliotic. 70 to 90% of cerebral cavernomas are located in the brain. Depending on their location, they may cause several symptoms. Supratentorial cavernomas, meaning cavernomas located above the tentorium cerebelli, present with bleeding, seizures, and, depending on their location, neurologic deficits, like muscle weakness and sensory loss. The bleeding rate per year is about 0.25 to 1.1%. Infratentorial cavernomas, meaning cavernomas located below the tentorium cerebelli, also present with bleeding and, in cases, neurologic deficits. Because of the high volume of critical centers in the brainstem, cavernomas located in it can cause worse symptoms than in most other parts of the brain. Their bleeding rate per year is 2 to 3%, and increasing neurologic problems are observed in 39% of the patients. After bleeding, the recurrent bleeding rate approaches 17 to 21%. The neurologic symptoms are very unspecific, depending on their locations, and can be related to many neurologic conditions. To diagnose cavernomas, the main imaging modalities are MRIs. Because of the slow and minimal blood flow in cavernomas malformations, they may not be seen in angiography. On CT scans, cavernomas usually seem as nonspecific irregular masses. Treatment options for cavernomas vary based on their locations, size, their clinical symptoms, and their history of bleeding. The physician may decide to observe asymptomatic cavernomas or some cavernomas at inaccessible sites. Stereotactic radiosurgery, especially for surgically inaccessible lesions, is an alternative to conservative therapy. Such treatment has been shown to reduce the rate of bleeding, especially after 2 years or more after radiosurgery. There are nevertheless potential complications, and such treatment should be carefully decided on by a specialist. Brainstem cavernomas are usually treated more aggressively when there is a neurologic deterioration with and without bleeding. If you have more questions about cavernomas, we recommend you to consult a specialized center. For more information about neurovascular malformation and diseases, you can also check out our other videos or visit us directly on neurora.org.